Well, certainly the longer braces are on, the worse it is for the teeth because of decay, gum problems, hygiene. So the quicker we can get done without compromising the end result, the best it is. So traditionally, when you put braces on, you put the braces on. There always is a little bit of human error, so there's a little bit of inefficiency. You put the braces on, you evaluate it, you got to take a step backwards, you go forward, you take a little step back, you go forward. And with SureSmile, we can usually treat in 25 to 30% less time. What we do is we start the same way that you do conventionally, get to a certain point, and that's a skill set that the orthodontist has to have to determine when to go into the technology. And then from that point, we can predict where we want to get to at the end. So basically with a computer, the advantage is if you know where you are and you know where you want to get to, the computer can connect the dots. And that's what the wire, a robot actually bends the wire to get from point A to point B. So from that standpoint, it's a tremendous difference. Also with this technique, we're able to do braces behind the teeth called lingual braces, which is technically extremely difficult. And the reason for that is when you're working on a circle, when you put braces on the outside of the teeth, you're on a bigger circle. When you're inside the teeth, you're on a smaller circle. And just from a basic physics point, the wire between the braces, the longer the wire, the more flexible it is. So when you're on an inside smaller circle, you have less deviation or less margin of error, and most people are not able to do that. But with the SureSmile, again, virtually we have that precision to do it to the best that is possible out there. And we take pride in feeling that our treatment, with the technology and just the dedication of the staff and the doctors, no one's going to get better treatment than they're going to get here. I can say that unequivocally.